So I'm just going to take a couple minutes and provide a little background on myself. And Caroline, you did a great job of getting some of that done for me. So thank you. Um, I spent first half of my career as a systems and sales engineer and learned RF engineering on the job. I graduated with a degree in mechanical engineering, and so worked in cellular quite a bit and did a lot of network planning. And most of my work since graduating college has been overseas in one form or another. I've worked at both large organizations, Caroline, more than 1,500 employees, and some very small organizations, startups in the 50 to 100 employees realm, and smaller than that. I had a dream job for 10 years in from 2000 to 2009, and was hired as global director of IT for a large conservation nonprofit based here out of Washington, whose roots are in the Nature Conservancy. And I got to build out their global network in 40 countries. Uh, did that over about a 7, 8 year period, and built an international team of 25. Enough travel for a few lifetimes. Next slide, please. In 2009, so I suffered my first layoff ever the day after my 38th birthday at the height of the financial downturn, which affected everybody. Oh, also I did forget to at the beginning. I wanted to thank Patrick O'Shaughnessy from Past Reality. I think I saw him in the audience for recommending me to Tom and Matt for the event tonight. So thanks, Patrick. Um, in 2009, I ended up a little bit by happenstance organizing what was the first conference about social media on the East Coast here in Washington. Got a lot of national press coverage and attention. PBS NewsHour filmed a 20-minute piece that aired that summer. And I didn't know what I wanted to do after the conservation work. I ended up doing 20 conferences by myself across the US and Canada. I was going through airports with 4 laptops and 2 projectors. And then in 2010, I had a book come out called about applied social media. There in the lower left. And much to my surprise, got picked up as a textbook at about 10 universities. And still looking for a niche in this space. And this is, the days of Mashable and Daily Beast, those things, Vice, early days of Vice. Uh, but no one had done a print magazine about social media, besides the obvious reasons of the slow death of print. But I was a big fan of print still, and my sister's wife's husband's cousin, if you can follow that, who's graphic designer. We put an issue together over a weekend and launched it at an internet conference at Javits Center, New York, in May of 2011. And 3 weeks later, I had national distribution with Barnes and Noble. And so bootstrapped this on credit cards out of my apartment. Uh, and but within a couple months, we were distributed in 20 countries, and we're across chapters in Canada and Fry's on the West Coast. And we were named one of the 20 highest, or sorry, one of the 15 highest magazine launches of 2011, and got some good notoriety and acclaim. Only time I ever raised any angel money, it was a very small amount from the former CEO of Time Inc. Short version of that story is it was a 2 month marriage and a 3 year divorce. But we put out 17 print issues over 3 years. You can still find copies resold on eBay, and still really proud of it. Was an expensive creative outlet, but loved every minute of it. Next slide. So I had a couple lean years in between, but I'm a long-time video gamer. Started with the Atari 2600 and have been through every system since. Always kept an eye on VR. Shortly after the Oculus Kickstarter, and then they got bought by Facebook. I started experimenting, and I think I did some of the early events that took place in around VR. Actually, we did an event in Chicago in 2016. I can't remember the name of the conference center, but not too far from the merchandise mart, which is I think where you guys are located right now. But experimented and was just trying to see where the interest was in VR. So VR in higher ed, VR in architecture, VR in defense. We did our first VR healthcare event 9 years ago here in Washington at George Washington University Hospital. Um, that was a good success compared to the others, and some of you may know Walter Greenleaf, who's been in the healthcare VR space for 30 years, and with his help, we put on a follow-up event at Harvard Medical School in March 2018, in between two nor'easters. But we had 250 people, and it felt like a moment in the space, even though this was still very new to me, especially in healthcare. So next slide. So I decided to just focus on healthcare in VR and started this association formally in March 2019 at our third annual conference. We launched it with 40 founding members. HP was an anchor of that. Working with them was great. I was really sad to see them get out of the market. We'll see if they come back into it at some point. And today we're about 130 members, give or take, and about 40% are outside the United States. And been great working with Hector, who is working both between the U.S. and Peru. Next slide. And so, my focus for the last few years and still moving forward is really just educating the market, educating physicians, nurses, practitioners, anyone we can get in front of. It's just a very slow process. I have not yet found a better method to convince people about VR and its power within healthcare beyond putting them in a headset. But how do you do that cost effectively and in a timely manner when healthcare is 20% of the U.S. economy? It's a slow process, one person at a time. But once you've convinced somebody, then they can usually run for themselves. But getting people to try it for the first time can be difficult. Next slide. We had a book come out. This was a 2-year project back in 21, hard copy. We went through 2 print runs of 5,000 copies. I was very lucky to get Palmer Luckey to do the forward for us. I really need to get this into a PDF and out there. I never got around to doing the Kindle version, unfortunately, but I will. You'll find some copies on Amazon, probably a couple on eBay as well. Next slide. Right now, we're planning our 7th annual conference in Europe, which is going to be in Iceland this November. A lot of excitement about it. Looking forward to it. Next slide. And I can't believe planning our 10th global symposium will be in Tampa Bay at Moffitt Cancer Center in early next year. And I think that's it. Next one. Oh, sorry. Also, back in 2017, I started an event called Virtual Reality Day. It was a day focused on public education. Back in 2017, the idea was, hey, let's hold it right around Thanksgiving during Black Friday time. Try and get people excited to buy headsets. This is back in 2017, 2018 time. It really blew up. We went from 7 cities to 76 participating. Maintained some good growth in 2019 and had a very large event in alt space for a couple of years. And then, unfortunately, the pandemic hit, and we went to online for a couple of years, trying to get it back to in person. I think we're at a point where we could benefit again from Virtual Reality Day. So working to get that organized for this year. Next slide. And my contact information, very easy to get a hold of. And that's about it for me.
Thanks so much, Bob. Appreciate it. And there'll be opportunity to ask some questions from the audience. But I did want to take on we had just talked about it briefly earlier, and that is, what do you think are some of the, obviously, we talked about the fact that I now work for a health plan, a small health plan. And what are some of the barriers, or at least some of the considerations in terms of health plans, hospitals, clinics from adopting or doing pilots? What are you seeing in terms of the environment? And then maybe what are some of the ways that you have seen companies be able to overcome that in certain ways?
Wow, tough questions. You don't make it easy. It's you know, I can't think of a much more difficult sector to try to work within than healthcare. It's not straightforward at all, and a lot of that
Right,
goes to how healthcare is funded in this country, particularly.
right,
You have both private, public, quasi. Um, so much is government funded. Insurance makes it all very, very complicated.
right.
Uh, and and actually, I was just doing a presentation for my class earlier today about it's kind of intro to VR in healthcare. And one of the things that there's a high bar you have to meet because it's not enough. Well, a novelty is not going to last for very long anywhere, but
Right.
oftentimes, sometimes, and I think Hector kind of alluded this to before, people just want it, and they'll try it, and because it's cool and it's great, and then it'll sit on a shelf. But for it to be adopted and taken seriously, it's got to meet a couple of high. It's got to be. It can't cost any more, and preferably cost less than the current solution. It can't add to the existing workflow. So if it's going to add time and headache to a nurse or a practitioner to use the headset, even though it may provide a lot of value, if it's adding minutes and headache to their day, they're not going to want to use it.
Right.
Um, and it's got to have the efficacy behind it as well. It's got to prove its value and that it has it can do better and provide better care and value than the current regime or current system. The thing is, though, when we think about things like that, I mean, one of the most valuable things that VR can bring to healthcare is education, and it's not
Yeah.
just at the nursing or med student level, but ongoing professional education.
Right.
And there's so much opportunity to, no one wants to go to the hospital, especially when I think I can't remember the statistic, you know, for sure, but something like one out of every, four, you know, issues that happen to you health wise is due to medical error.
Yeah.
Just as many things happen to you while in the hospital uh, than uh, than what you originally went in for. And a lot of medical errors are can be prevented. They're human
Yeah.
caused, and a lot of that comes down to education. Um, anyway, that's maybe a short version of trying to answer some of the barriers. I think
Sure.
from a success standpoint. Uh, it really it's about finding the right champions. Honestly,
Right.
it really also. I think for healthcare to succeed, it needs leadership and senior buy-in. Leadership wants to see technology applied and used. Um, Rarely, I won't say never, but sometimes a grassroots approach will work, but then it takes a lot of work and effort by a couple individuals that might be on top of their normal job trying to get
Right.
interest. Um, but uh, uh, but we're seeing, there's plenty of good studies that demonstrate the value and the impact that it can have both in variety of whether it's for the patient, for in operative surgical use or in hospital,
Right.
or for creating better physicians and nurses through training. Um,
Right.
but it's just a there's friction with it. It's not easy to adopt. We're as an industry, you know, Pico, Meta, HTC haven't making don't make it super easy to adopt, and Meta, being the large um, uh, uh, market player,
Mhm.
hasn't made it easy. But you know, but the data is there, the proof is there, and it's a cultural problem too. It is. If you're a doctor that's been teaching anatomy for a certain way for 20, 25 years,
Right.
it's can be hard to be convinced that you should use VR and teach in a different manner.